Welcome to the NCCDP YouTube channel. I'm your host, Alexandria, and joining us today is Rhonda Wilkin. Welcome to the channel.
Thank you.
So before we get into our topics today, do you mind just sharing a bit about who you are and what you do?
Oh, thank you. And thank you for inviting me, Alex. I appreciate it. So my name is Rhonda Wilkin, and for my entire career, 35 years, I've been in health and human services with the last 20 in direct senior care. I'm actually an administrator, and I've managed a number of large communities, including those that are high acuity, high clinical memory care only communities. Last year, I ventured out on my own and I opened up Dementia Partner. I'm a geriatric care manager, a senior advocate, and of course, an Alzheimer's and dementia practitioner. I earned my CDP back in 2017, and then in 2023 became one of the national trainers. So I'm actually one of the organization's certified national trainers, and I love going out and helping other professionals. I love helping families through this journey and helping people through the journey. I've been there myself. My mother was third generation, so it's touched us all.
Yeah.
I have a lot of community involvement, including being a board member of the Alzheimer's Association here in the Southland chapter.
That's awesome. Your resume is stacked. You're doing so much.
Thank you. It feels good. Yeah, it does. It just feels good to give back and to help and to work for hugs and love. And yeah, that's the best part of it.
That's awesome. Well, thank you for joining us today.
Thank you.
Have you ever heard the phrase, live their reality? Rhonda will help guide us to a better understanding of communication techniques that can make a real difference. She'll go over her top 10 tips for communication, why respectful communication matters, and how to stop much of the frustrations and arguments. Rhonda, what are some communication skills that people can use to help?
Well, we know that communicating with somebody with dementia can be challenging. There's cognitive challenges, there's language challenges, and of course, there's memory challenges. And so communication often takes patience and empathy. I have 10 tips that other professionals have shared with me, and I'm happy to share them with the group today. The first one is we want to keep it simple. So we want to use simple words and short sentences to avoid overwhelming our loved ones. Avoid long, complicated sentences and explanations. Essentially, remember to use the KISS method. Second, we want to be patient and allow time. Dementia slows down our processing. You know, it's interesting. You and I can go from point A to Z, and we'll do A, B, C, D, E, and F all the way to Z. So our loved ones with dementia, their processing, it's not in a straight line. It's all jumbled and circular and zigzagged. And so we want to keep things patient, and we want to allow the extra time. So remember, practice patience. Third, please avoid correcting and criticizing. Avoid trying to correct somebody. That leads, honestly, just to frustration and confusion. If they remember something differently, you need to go with it. Here I like to tell people to remember you can't argue with the disease. I remember with my father, I had Post-its all over the house for him. You can't argue with, my mother's name was Marilyn. I would cross off Marilyn and write the disease. You're going to lose. You're now trying to argue with someone with a cognitive disease. Number 4, focus on feelings and not facts. Often, how you say something is more important than what you've said. Remember, don't take it personally. People, our loved ones with dementias and Alzheimer's, they often have lost their filters and sometimes can say hurtful things. So just don't take it personally. 5, use nonverbal communications. A gentle touch, a warm hug, your eyes, smile through your eyes. Nonverbal communications can go a long way. Here I like to say, remember, eyes are the windows of the soul. Try to minimize distractions. That's number 6. Watch the background noise from a TV or a crowd can often be overwhelming for our loved ones with dementia. So try to communicate in a quiet space, lower voice. It helps them focus better. And actually, here, remember that watching bad news on TV can cause distress for our loved ones with people with
Crazy.
Alzheimer's. Crazy.
Who would have thought?
Crazy. I can tell you stories where I was managing a home in the Coachella Valley. There were fires in Northern California. The news was on by mistake, honestly, in my community. And a few hours later, I had some of my sweet residents thought we were on fire.
Oh, no.
They just can't differentiate the bad news. It's so, don't add to the distress.
That makes
Just turn
sense.
it
Even
off.
without dementia, watching the news can make you get stressed out. So
Absolutely.
adding dementia factor.
Absolutely. You
It's a
know,
lot.
we love our rom-coms. I love Lucy.
Oh, same.
Old movies. Those are the best.
Watch the Hallmark films.
Oh my God. Absolutely. My favorite channel. Number 7, be positive and reassuring. People with dementia often feel anxious and they're insecure. So a positive tone and reassuring words can make a big difference to help them feel safe. So here I like to say, remember, breathe. For us, remember to breathe before you speak. Number 8, ask one question at a time. Multiple questions are confusing, and to make it easier for them to respond, craft questions that are really dementia sensitive. It'll make conversations smoother. So here I say, remember to ask for help to encourage purposeful engagement. Say, I need your help with this. Come with me. I can't do this without you. Ask for their help. Number 9, embrace the reality. Often people with dementia will remember things differently than you and I, and they may not recognize the current circumstances. And so instead of trying to argue, try to join them in their world, in their reality. This will help with stress levels. So here I say, remember to live in their reality, so not to cause pain, and learn the art of the fiblet. And number 10, practice self-care and seek support for you, for those caregivers that are trying to help our loved ones with dementias. Supporting somebody with dementia is emotionally taxing. So remember to take care of yourself and reach out for help when needed. Look for certified professionals who can provide all sorts of resources and coordinate care. And here, just like on an airplane, if you're a parent traveling with a young one, I say, remember, put your oxygen mask on first.
I feel like so many of these tips can also apply to like just people in general too. It's kind of like crazy to hear, and it's just like slightly different, adding in when you're interacting with someone with dementia or caring for someone with dementia. But it's crazy hearing these things and I'm like, wait, I should apply these things to my life and my relationships. I feel like it allows healthier communication in general.
Absolutely. Absolutely.
Breathe before you speak. Maybe take time to think.
Live
not
in their
taking
reality.
things too personally. It's about how you say things sometimes and not what you say. Or that's kind of crazy how that
smile
really
with your eyes. Absolutely.
Tyra Banks got to smize. She was onto something.
Yeah. Absolutely.
Now I'm curious, can you share a little bit more about what you meant by the art of the fiblet?
Yes. So I've been talking about the art of the fiblet for so many years. Other folks in the industry will call them loving lies. But fiblet is an actual term, and it was coined in 2000 at the World Alzheimer's Congress, meaning it's a necessary white lie to redirect loved ones and discourage them from detrimental behavior. There are many times that fiblets work well, so I'm going to share a couple of them. When we placed my mom, my dad needed an exit strategy, and so I said, you're going to have to come up with a fiblet as to why you're leaving the community. So the first time he said, Marilyn, I have a doctor's appointment. My mom grabbed her purse and went to follow him. And I'm like, Dad, you guys always did doctor's appointments together. So we came up with a fiblet for Dad. They had retired, and he was a salesman his entire life, right? And he had his little part-time job to keep himself busy selling golf carts. So now, every day, he said to my mom, I have to go deliver a golf cart, because she would never go with him. So that was his fiblet. He caused no harm, and he was able to leave. And he always just said, I'll be back. And he was. I remember counseling another one of my sweet residents. The wife used to tell her husband, I have to get to the women's club at church. Now, she didn't have a women's club meeting at church every day, but it was a reason for her to leave effectively sympathetically, do no harm, and he was fine. Another one that comes up a lot, if somebody with dementia asks about someone's death, maybe some, where's my husband who died 15, 20 years ago? You're actually doing more harm if you say, don't you know he died? Because you're bringing that person, honestly, right back to the day that person died, and you're causing harm. It's hurtful. And so we often just say to redirect and come up with a fiblet. So if somebody says, where's my husband? I might say, oh, he's out running errands. He said he'll catch up with you later. So let's go take a walk. So now I've just redirected or I've taken their mind off because I don't want to cause harm. We just don't want to do that. This one is common also. I'll have moms who 20 or 30 years ago had to take care of young children, and they'll say, oh, I need to get home because the school bus is coming soon, right? And we now know their children are adults. But I'll say, no, it's okay. They had a field trip today. You have a few extra hours, so come with me. Let's go take a walk. Those are fiblets. Do no harm and just redirect. So what I do with clients a lot is I teach them the art of the fiblet. So we practice what will work and say it often enough so it becomes natural, so it doesn't sound like you're having a problem.
It sounds like a great way too to, like you said, not cause harm, not cause them more distress or anything like that, and just make them a more peaceful transition, a more peaceful day, a more peaceful and calm moment.
Absolutely. Sometimes we even, if a car is taken away, a doctor or the DMV has said somebody can't drive and they still think they want to drive. I've maybe had a plug misplaced, taken the car into a shop and asked my mechanic friend, please tell them it'll take a while to fix. But again, we're doing no harm. They're loving lies that we need to do sometimes.
Thank you, Rhonda, for joining us and sharing your wisdom with us. I learned a lot myself. I'm sure the people watching have learned a lot as well. Thank you all for watching. I hope you gathered something from this. If you would like to learn more or maybe even become certified as a dementia practitioner, our website and social media will always be linked down below. Also, let us know if there's any specific topics you would like us to cover. We want to hear from you and make content that you are looking for. Thanks for watching, and we will see you next time.